Dear students, last class we have already discussed about the blood. We found what is the function of blood we found, and what is the composition of blood, that is already known to us, but still there was a brush up session. And after that we came to know what is the actually blood means, what the drugs are acting on blood. Okay, so today on that consequent of this particular topic we are going to find out the material, the name it will come, that is coagulant. So the drug related to coagulant we are going to study today. Prior to that we should know what is the coagulation. Coagulation means here when there is a wound on our skin, or there is a wound on our internal portion, whatever it may be, that wound or hemorrhage, it will try to recover, it will try to stop the bleeding. When this bleeding will get stopped, there is a mechanism it will happen inside of our body, that is called as clotting mechanism. Now in this clotting mechanism, total 12 factors are there which is responsible in different steps of our total blood clotting. Factor number 1 to factor number 13, total different factors are acting on that. Factor number 6 is absent over there. In the list we found to know factor number 4 is calcium. So factor number 8 is Hegman factor. So different factors are there. That is already very common to us. That is a very basic thing. So this way the blood is going to get clot in our body. Okay, whenever there is a hemorrhage, blood will going to get clot. Now suppose this is not getting clot properly, we have to apply something which will increase the clotting mechanism. So prior to enter to the drug, the most important thing is what is the 2 or 3 step mechanism which is happening in the clotting. First of all, we can write that there is a name, there is a substance that is called as prothrombin. Prothrombin will get activated. Prothrombin will get activated and it will get converted to the thrombin. Prothrombin will get activated and it will get coagulation. So prothrombin will get activated and it will form the thrombin. In presence of thrombin, fibrinogen will get converted to fibrin. Now this fibrin is an insoluble substance which does not dissolve in water, this fibrin. So this fibrin is responsible for making our clot. In very easy 2 to 3 step mechanism you can tell this. Now different factors are acting on different stages of that. Even the cells are also responsible for your clotting. Because when there is a blood flow, the cells will act like a what should I say? The cells will act like a solid substance which will support our clotting. This fibrin produce the meshwork. This fibrin produce the meshwork of the wounded area. And on that wounded area, the cells will come and it will aggregate over there to make a solid structure. So when this solid structure will form, then our blood will stop flowing. Actually the clotting will achieve over there. This is the basic mechanism of clotting you should know. It should be very clear to us prior to entering to the drugs acting on clotting. So now prior to entering to the drugs acting on clotting, now we are going to find out, suppose these things is happening, which is the most responsible element or most responsible cell in our body which clogs or which enhance the clotting mechanism. That is number one is, what is this? Platelet. Now platelet is going to get aggregated when there is a wounded area. What is the meaning of this aggregation? When there is a wound, when there is a cut, platelet will go and platelet will get settled down over there, and all the number of platelets, they will get settled down over there, and there is a chance of overlapping. Okay, so this is called as platelet aggregation. This platelet aggregation is going to get instigated. This platelet aggregation is going to get instigated by the hormone that is called as vitamin K. Okay, so this vitamin K is also involved in our total blood clotting mechanism. Now, whenever the drugs we are going to use, whenever we are going to think about the drugs which will be useful in the clotting, remember that in our normal body, clotting or coagulants or anticoagulants, does not required. But when there is any of the injury or any of the abnormalities or any of the pathological situation arise, then these drugs may require. So coagulant means which enhance the clotting mechanism. Which enhance the clotting mechanism, they are called as coagulants. Okay. Oppositely, what is anticoagulants? Means which retard the time of clotting, which delay clotting, which inhibit clotting, they are called as anticoagulant. Both are our point of interest. First of all, we will go for coagulants. Coagulants means, just now I told, whenever there is a question of coagulant, the first terms it will come to our brain, that is vitamin K. Vitamin K is a fat soluble substance which get produced in our liver, and after that it gets spread out all over our body, which is essential. The main role it is going to take, that is clotting. It's help for clotting mechanism. Okay, or it's enhance the clotting mechanism. Now, from where this vitamin K we are going to get? This is a dietary source. We are going to get a vitamin K enriched food. Daily requirement is 10 to 30 microgram per day. Very little requirement it is there for our body. We can collect it from any greeny leaf vegetables like cabbage, spinach, lettuce. Okay, so parsley, all these means leafy vegetables, they are having good, very good enriched source of vitamin K. So we have to take all these things, means we have to require these things. So this vitamin K, wherever it will go, it will enhance our clotting mechanism. Now when this enhanced clotting mechanism is required, enhanced clotting mechanism is required when there is a injury but the blood is not going to get stopped. If this process will continue, what it will happen? The blood will start flowing, it will go outside from our body, and automatically we will lose our life. There is a life threatening situation. Immediately you have to stop. Okay, so the prime choice is vitamin K. This is oral formulations are also available, but we are going to give the IV injection. IV injection is sometimes cause some of the side effects like irritation, itching, along with that flush, discomfort, abdominal cramp. All these things are very common with vitamin K. Okay, so the dose has to be more, we have discussed. So this vitamin K is very essential for our body. But remember that vitamin K deficiency, it is occurring in our body. It's indicating there is some liver problem, it is there. It may be liver cirrhosis, it may be liver damage or malfunctioning of the liver, whatever it may be. But if a liver is working properly, then the vitamin K concentration, it is decreasing. It is very rare to see. Okay, so this vitamin K is very essential for our blood clotting. And along with that, this vitamin K, already we have discussed that this is having few range of side effect. Along with that, this may produce breathlessness, and whatever the whatever the coagulant drugs are there, they are one common side effect, that is they are having a tendency to fall down the BP. That is a major side effect. And along with that, vitamin K, you have to give the IV injection, you have to take care, the patient should be taken care under monitoring. Sometimes we can use fibrinogen or anti-hemophilic factor, because they are marketed formulations are available as in the treatment of bleeding. But remember that these fibrinogen and anti-hemophilic factors, they are actually derived from the human placenta. Okay, so these products are going to get isolated from that, and they are bit costly product. So but still they are in the use. And along with that, another one formulations it is available, that is called as routine. Routine is a plant product. It is going to isolate it from the plant, and we are using this drug as also a as also a coagulant. And along with that, we can use sometimes, very important, you should know that, the ethamsilate. This is a chemical product, ethamsilate we are formulating, and this ethamsilate actually prevents the platelets what is this aggregation. Ethamsilate actually correct the abnormal platelet function. So whenever there is a bleeding, internal bleeding, it is there, that has to be get rectified. Because of this, it is controlling the platelet aggregation. So this also is in the use as a coagulant drug. So we have seen whatever the coagulants, and the most importantly, regularly we are using vitamin K, along with that fibrinogen, anti-hemophilic factor, and ethamsilates also are in use. You may get this topic in the question of means there is a guess that a question within 5 marks, short question you may get. Along with that, you can going to find out you may get this question as in 5 marks, means as we can guess, and that 5 marks short type question you may get. This is a topic, that is a coagulant. Okay, along with that, we are going to get that anticoagulant drug. Anticoagulant drug means here we are using the substances which prevents the clotting. Okay, which prevents the clotting. Coagulant means the if some the internal of our organ or our gums, so this is happening that continuous bleeding is there. So we have to prevent that bleeding, but this is not going to get stopped after any of the surgery. Also it's required. Internal organs and hemorrhages due to bacterial or microbial stain also it is required. So at that condition we are going to apply this coagulant. Coagulant is going to prevent the bleeding. Sometime gum injury or after the teeth removal, so mild operation, this type of drugs is required to prevent that bleeding. At that condition, some astringents acts very nice action, that we will find out in the very next class, because they are having a different type of mechanism. So we are having these particular substances sometimes in mild or some major operation, some of the case internal damages, we have to apply this drug. otherwise it is not going to get stopped. Sometimes that bleeding may cause habitual abortion also. To stop this, that time also coagulants is required. So remember that. Along with that, as far as when this coagulant is required, some opposite condition is also there, that is the use of anticoagulant. Anticoagulant are the substances when there is a coagulation, it is or clot, it is forming in unwanted area, we should stop that. That is called as anticoagulant. Remember that anticoagulant is very essential drug when there is a heart surgery or the patient is facing anginal pain or myocardial infarction, congestive heart failure, all these situations that anticoagulants are required. Anticoagulants means sometimes it is happening in our blood vessel, so the vessel is going to get damaged, and there the blood immediately it will come with contact with the what is this broken wall, and it will get blocked, or it will produce the what is this a clot. So this clot, whenever it will produce, what it will happen, suppose it is making a clot in the inside of the artery or inside of the vessel, it will stop the flow of the blood. So if that is a heart related, means if this vessel is related with the heart, means it is circulating the blood supply to all over of our body, or it is collecting the blood and it is pouring to the heart. So whatever it may be, or it may be coronary vessel or artery, so coronary arteries also, inside of that this clot may produce a major condition, major pathological condition. Why? Because after producing this clot, means immediately the heart or whatever the circulation, it will get stuck over there, means whatever the flow rate was there, this flow rate will fall down, and in this condition any of the coronary conditions, coronary pathological situations, it may also arise. Suppose this, the first beginning symptoms, we are going to get angina pectoris followed by myocardial infarction, and after followed by what is this congestive heart failure. Already we have covered all these things. We've seen the basic things of these things is what is this platelet clot formation. So suppose any of the patient open heart surgery is happening or bypass surgery it is happening, so they are making the seizure inside of the body, so their clot should not produce, but it should heal without producing a open clot, because if a clot will produce, the total effort it will go on drain and the life will be under threat. So it should not happen. At that condition we have to use any of the what is this anticoagulant substances. Anticoagulant substances, whenever we are going to discuss, one of the important name it will come under our brain, that is called as heparin. Heparin, it is a biological substances, it is a biological substance, means it itself produce inside of our body. Where it does produce, it produce in our liver. This heparin get produced and it is going to block the overactivity of platelet. So this heparin, it is going to prevent that is the overactivity of vitamin K. How this overactivity of vitamin K is going to get decreased, that's I am going to tell you. So remember that two of the names it will come. One, it is called as heparin, another one, the name it will come, that is warfarin. So this warfarin, it's exactly not producing inside of our body, it is a synthetic product, and this warfarin, it's having a unique nature that it does not work in vitro, it only work in vivo. So this warfarin, if you are applying, heparin is our, means itself it is preparing inside of our body, it is a endogenous substance. Okay, so when this heparin is controlling our feedback mechanism, but when there is a essential substance, means essentially we have to give some substance, if we are applying that warfarin, this warfarin in laboratory, it will not produce any of the action, means it will not show anticoagulant action, it will show only when you will apply inside of your body, because there is a mechanism which is very related. We have to know this mechanism. So remember that decarboxy prothrombin gets converted to prothrombin. This is the activated prothrombin actually. Decarboxy prothrombin. This is the pre-formulation, product of prothrombin. So when this is happening, at the same time there is a conversion of vitamin K hydroquinone epoxide. So at the same time vitamin K is going to get converted, but it is an auto regenerative process. Means once again it will come back here and once again this circle will happen. So in presence of that, decarboxy prothrombin will produce the active prothrombin formulation. So what it is happening here, warfarin, this NADH will get produce NAD. So from here, whatever the energy is releasing, by that this movement, this cycle is going on. So warfarin will go and it will block this area. So what it will happen? Vitamin K epoxide form, it will unable to come back to the hydroquinone formation, vitamin K. So when this will not come, there will be a shortage of this formulation. So it will not get chance to get converted to vitamin K epoxide formation. So when vitamin K epoxide it will not produce, automatically prothrombin, activated prothrombin formation, it will get stopped. So I told very beginning, just remember, first step of what is this blood clotting is activation of prothrombin. Prothrombin will get activated. In presence of prothrombin, thrombin will get prothrombin will get converted to the thrombin. Then in presence of thrombin, fibrinogen will get converted to the fibrin. Fibrin is an insoluble polymer which will produce our clot. So this is the mechanism. So if the prothrombin will not get activated, prothrombin will not get converted to the thrombin. So by this way, this total our warfarin is stopping the clotting mechanism. Okay. So this is the today we have studied. They are literally means actually they are quite short topic. You may get the short question type of questions over there. Chances is that. So here we found what is this, the clotting mechanism brush up we have done, and after that two of the drugs today we have discussed, that is the coagulant and anticoagulant. Just go through this, okay, and very next class we will discuss about that. Some 2-3 short topic is there related to the blood. We will complete this and we will cover up that particular chapter. Take care and be safe.